My name is Anton Zytnik. I'm a Senior Health, Safety and Wellbeing Consultant with the Victorian Chamber of Commerce and Industry. In this interview, I'll be speaking with Amy Bell. Amy is a Principal Workplace Relations Consultant with the Victorian Chamber. She is a dual-qualified non-practicing lawyer and has over 10 years' experience in private legal practice specialising in employment law. In this interview, we discuss a range of questions commonly asked by employers about how to react and respond when mental health is raised by an employee in the context of a disciplinary process. We talk about how the employer should react in the short, medium and long term, some tips around dealing with treating doctors and independent medical assessors, and also how to make reasonable adjustments in the workplace so you can best support your employee. Thanks for listening. An employee discloses a mental health condition. How should the employer react in this circumstance? Let's say, for example, I've had depression for 6 months. My psychiatrist has recently changed my medications. It's caused sleep disturbance and mood volatility. That's why I swore at our most important client who's now cancelled their account. How should the employer act, firstly in the immediate term and then in the time after that?
I think in the immediate term, the first thing that crops up in my mind is when you're at those stages of meetings of that nature, you need to make sure that you have that open mind and not have a rigid script in place. When that employee, presumably this is the first time they've volunteered, because they don't have to, they've volunteered this information, you need to, I suppose, appreciate the candor that they are adopting it and giving you this information and accept that it may have been something that was difficult for them to share with you. So offer some sort of gratitude that you're grateful that they've shared that information. And depending on your comfort level, can you have any discussion to explore that a little bit more to help you understand? But importantly, that is a real sign that you need to stop and take stock. And with all disciplinary performance management meetings, we shouldn't be scared to do that. You come across some information, you're not really sure what to do with it, but in this case, we really need to understand more. We need to understand, is this information they're disclosing, this mental health condition, has that impacted in any way the behaviour, the conduct that we're trying to address now? We don't know that. We're not practitioners, we're not professionals, so we need to make inquiries to understand that. So stop, take stock, I think is the best piece of advice. Don't think you have to rush through that meeting. You absolutely don't. Is
it typical in your experience that employees do raise this later in the piece? That's certainly been my experience, that perhaps they would prefer not to have disclosed earlier on, but when they get to that moment of thinking, I'm possibly going to lose my job, that is often when it comes out? Absolutely. And sometimes it can be, if you think about, let's say, a show cause process, you would have had some sort of discussions, whether it's interviews or just a preliminary discussion with the employee. So this thing isn't coming as a surprise, but notwithstanding that, it's often that they will avoid disclosing that information until very late in the piece. So it might be that you've had the main disciplinary meeting, you've had an adjournment, whether it's an hour a day, a week, you're then having the final meeting, you're in the position to deliver the outcome, and then that information comes out. So again, there is no strict procedure you must follow. You can have as many meetings as you think you need, as many adjournments as you think you need to make sure you are fully informed and can make that assessment. Has it actually impacted the behaviour? From your perspective, how do you and your team normally counsel employers who are pretty revved up and seeking a quick fix? Yeah, unfortunately there are no quick fixes. That's the important message from day one, that you'd started on any sort of process. I mean, if I think about the amount of times I will get calls from members and clients, so-and-so has done this, they're sacked, they're gone. And it's about saying, hey, let's slow down. Let's look at what's happened. Let's make sure we make those inquiries and listen to everything. Give the person every opportunity to give us that information, and only then will we make the decision. Sure, people get frustrated and annoyed. If, the shoe was on the other foot, realistically, we all would want to be in that situation. If this was our business, our money at stake, we're going to want to resolve this as quickly as we can. But no doubt we'll talk about it later. When you think about the risks that are involved, and no doubt the time that you've already invested in this person, they might be a great resource, and you might be cutting that off for something that can be managed.
I mentioned the scenario where it's fairly clear cut. So the employee says, I've been to a doctor, I've been diagnosed, I'm taking this medication, and they're clear cut situations. A question that often arises is, what do we do when it's just less straightforward? So an employee might say, I think I've got depression, but I don't believe in doctors. I don't like going to doctors. I've just diagnosed myself. Or maybe they don't even articulate it that way. They might just say, well, I don't know what's wrong with me. I've just been feeling so down recently. I'm anxious about everything all the time. I drink to excess every evening to forget about my problems. So the employee may not necessarily have insight into the fact they have a condition. How should the employer regard that scenario when it's just more ambiguous?
I think firstly, the employer should be keeping an eye out for those signs, those symptoms, those concerns, and be having those conversations early on. If it is at the later stage and they're making those sorts of statements, an employer is thinking, this sounds like there's more to it, we need to understand this a little bit more, I would say the same would apply regardless whether it was diagnosed or not. Obviously, in the scenario you've given where someone has said, they don't believe in going to doctors, you really need to try and get the employee on board to understand why it's important for you in turn to understand the condition, how it, if at all, it impacts their ability to perform the inherent requirements, and how you can help them, what adjustments you can make. I'd say it's ideal to get them on board because they're going to be much more amenable if they're on board and they understand to going to whether it's their GP or an independent medical expert. Ultimately, it might get to the case where if they're just not amenable, that you have to direct them to do that. So whether it's clear or whether it's vague, but either the signs or the language they're using raises those concerns, you need to act on them.
I imagine there would be borderline cases as well where you might have an employee who their personality, their disposition is such where the employer might suspect there's an underlying mental health issue, but the signs of it in the workplace are not so extreme as bursting into tears often or having emotional outbursts, but a person just has a certain personality type where there's a suspicion there might be something going on, but the employee doesn't necessarily see it that way.
Yeah, and a good example of that is you may have someone that, it may be a condition, it may not, they may just be incredibly introverted and not be particularly social and try to avoid a lot of social events. If you can get that understanding that they're uncomfortable in those sorts of situations, then you can think about, okay, well, how can we deal with this and not make a big issue out of it? Because it's not a big issue. But yeah, it's certainly about what can we do to look out for those signs. Do we need to act on all of them? Not necessarily in a formal way. In that scenario, there's ways you can work around it that's beneficial to everybody. But if it is those emotional outbursts, if you are noticing somebody cannot concentrate, can't remember, can't retain information, whereas you've seen they ordinarily or previously called, then that should at least prompt a conversation. Has anything changed? I've noticed these differences. Is there anything we can do to help you? And really monitor that to see whether there is any improvement.
Which is the focus of our training for frontline managers. We're not trying to turn them into specialists or doctors or psychiatrists, but just give them the baseline skills to pay attention to those changes and to intervene in a supportive and constructive way with their employees while not necessarily taking on the role of their doctor.
They're the eyes and ears, and they know these people more than anybody else. Often it's those frontline managers that are dealing with these employees day in, day out. They know what they normally do, how they normally perform, what they can normally cope with. And when things start to shift and change, they really should be picking up on that.
So let's talk about more the middle term response here. So in the moment, we've done the right thing. We've paused the meeting or adjourned it. We've got new information we need to consider. Let's imagine a scenario which is more of the prior sort, where it is more clear cut. There is a doctor on the scene. There is a diagnosis. Would the thing to do at that stage be to seek that employee's consent to liaise with the doctor, understand a bit more about the impact that the condition may have had on the behaviour?
Yeah, absolutely. Absolutely. Yeah. Like I said, it's always best to get that consent, to get them to understand why and liaise with the doctor to understand exactly what you've just said. And that is the conduct, the behaviour, the performance, whatever it might be, was that caused by, was it a manifestation? There needs to be a link there. And that's what we're interested in.
They're trying to consider both the causal and temporal link between the error or the series of errors or the poor performance and how the condition might have impacted that.
Yeah, as well as moving forward, what, if anything, can the business do to prevent that situation?
What would happen in a scenario if the employer receives that information back from the doctor? It's either vague in nature or it's specific enough, but the employer doesn't believe that there's enough of a causal link. How should the employer proceed in that scenario?
I think it depends on what the information is and how they're interpreting that. They can, and again, don't feel afraid to ask more questions. You can go back to the doctor and ask more questions.
Yeah.
I would say the severity of the conduct and the potential consequence is going to be very relevant. So I would certainly be asking a lot more questions if termination was a possible consequence here.
Yes.
So if I'm thinking of dismissing someone, I really must and ought to make some thorough inquiries. If I'm not convinced, and it does happen, you get some very vague responses. You ask a question that's 4 sentences and get a yes or no response. Go back and ask more for more information, or you can consider going to an independent medical examiner. If you're going to do that, ideally go to someone or a provider that you have some links with, or you can get some recommendations, because that line of inquiry, whilst it's great, you ought to get a thorough report. They can take time. There's a cost that's attached.
Yes.
And it's really important that you do invest the time in drafting a really detailed letter of instruction. When you're reading that first doctor's report, in your mind you're saying this isn't enough. Well, what is it that you need to know? And they're the things that we need to process.
This is a challenge we have with a lot of small and medium-sized businesses. I mean, in metropolitan Melbourne, it's about $2,500 roughly for a consultant psychiatrist, obviously, and the half day to a day project of crafting that well-worded letter with all the information you need. We often advise in training that there really is no way around that if, for whatever reason, there is no doctor on the scene, or the employee does not wish to consent, or they consent but the doctor doesn't wish to engage, or they engage but we never get past those vague responses. There's no other alternative really for the employer in that situation, is there?
There's no quick fix. If there were, we'd be talking about it. And ultimately, the risk sits with the employer, the risk sits with the business. If they make a decision based on that vague doctor's report and they themselves agree it's vague and there were further questions, it's really opening themselves up. In corresponding with the doctor, the medical experts, we're trying to understand that causal link, but we also want to understand what can be done to help manage this. If we have an employee who has a mental health condition that manifests in some sort of behaviour that we cannot tolerate, it's going to be very hard to welcome them back into the business if we don't understand what steps, what action will prevent that happening. And I think we need to understand that in a lot of cases, plans can be put in place to ensure your colleagues and your business is not going to be impacted by that, and you can manage it appropriately.
So if we imagine the same scenario that we started the discussion with, where it's a long-term performance issue and we discover that someone who's not meeting their targets as a picker and packer has been masking a shoulder injury, maybe because they're worried they'll lose their job or whatever, but it comes out at the end stage. It would be nonsensical for that employer to say, well, one of two things: either I don't believe you, or okay, I'm sorry to hear about your shoulder injury, but you're still not meeting your targets and we have a business to run, therefore you're gone. Do you see that there's a lot of helpful comparisons that can be made to the physical world for employers who are just confused about how to proceed?
Definitely. It's
no different, really.
It's no different.
Theory.
And I appreciate it can be very challenging for employers because it's very easy to get and understand some medical evidence that says someone's dislocated their shoulder, they've, whatever it might be.
It's the scan.
And there's lots of doctors that would feel a lot more comfortable saying the recovery on this type of injury is typically X, and during that time they can't do these movements, or they can but they need this break and they can only lift this weight or that weight. There can be some more vagaries around mental health conditions, but absolutely that's the analogy, and that's the point you're trying to get to. I find a huge challenge for employers is having that
open or that shift in mindset to say, okay, well, their job is usually these 4 tasks performed at these intervals on these days. Well, can you move these things around? And an employer can become so fixed. Well, that's the way we've done it for 20 years. Why would we change it? Is it because it's inconvenient? If the answer is yes, well, that's not really good enough. Got to be prepared to make these changes.
Or else mount an argument that this is going to impose unreasonable financial hardship on me as an organisation.
Absolutely.
But inconvenient but doable as well within the scope.
Yeah. The response, this is the way we've always done it, isn't gonna wash.
What do you say to an argument that often comes up around precedent? That is an absolute common one that comes through in the training room around, well, the doctor's recommended a part-time working arrangement for this person. I've knocked back 6 colleagues in the last year for the same request. If I grant this, I'll have a right on my hands kind of mentality. How do we address that?
I think there's probably 2 issues there. One is if that recommendation has come from the doctor as a reasonable adjustment and it's something that you can do, regardless of what these other people are going to think, you really need to be putting that in place. The other is more of a question of how do you manage the rest of the team? And that's something that is probably relevant in a lot of mental health cases, and that does become quite a frustration for employees, which is probably why they're keen to deal with them so quickly. And that is, if we have someone outside looking in, we may see an individual who is working reduced hours, who isn't performing. That creates a further workload for the rest of the team. They may start to resent this other employee. We need to manage that. But privacy there is obviously a really key point. We don't want to disclose anything the employee isn't comfortable with us doing so, but we need to make sure in that scenario that those employees understand that each request or recommendation that somebody works reduced hours is assessed at the time it's received, having regard to all of the circumstances. It does not create a precedent.
Do you find Fair Work certainly would look more favourably on an employer who at least had gone to the effort of trying to work through that process, even if the conclusions that they reached in the end may not have been the right ones? Just the very acceptance that a mental health condition can be a mitigating circumstance and the desire to seek information about how the condition may have impacted the behaviour. I mean, surely even just working through that process is a good sign.
Absolutely. The Fair Work Commission, if we're thinking about an unfair dismissal, the unfair dismissal jurisdiction, they will look at the process that you followed and the thought making. They will be incredibly keen to understand what was the employer's response, and the key thing here is that they raised this as mitigation, and did the employer consider that response? So obviously if they have gone away and made inquiries, spoken to doctors, perhaps they've ultimately made a decision on a letter that could have been better, it will demonstrate that they have properly considered and taken on board that information, as opposed to someone that's not gone down that road at all. That shows to me you've not listened to what their employers had to say. You've given them an opportunity to respond, but you've not taken that into account because you've not made any inquiries. The other thing to bear in mind is if further information comes to light, such as medical information that goes to this mitigating circumstance that the employee raised, even though that wasn't available to you at the time, it's something that the Fair Work Commission can and likely will consider. So if they've raised it, you've ignored it, you've pressed on, you've ultimately dismissed the employee, and then at a later date they have produced evidence that demonstrates, yes, this condition did exist, it was relevant, the Fair Work Commission will take that into account, even though it wasn't available to you at the time.
What about in scenarios where it also wasn't available to the employee? So you might have an employee who has been dismissed, and then a week or so after the dismissal, they realise that they have a diagnosable condition, they get help, they get a treatment plan. What is the risk for the employer in those scenarios where the information was not only not available to the employer, but also not to the employee at the time of the dismissal?
I think there's 2 things here. Is it the case that the information wasn't known, or is it the case that the condition wasn't known?
If the condition wasn't known by the employee and they didn't raise it, it's very difficult for the employer to have done anything, provided they've given that opportunity. No information has come to light. They're making the decision based on the information.
What they have at the time.
Yeah. If it's the case that they've made the disclosure, but the report, the letter, whatever it is, wasn't necessarily available, I think there is still an opportunity there to make those inquiries to try and elicit some information to help the employer understand.
Let's talk a bit about case law here. So what has been the feeling in recent years? Are there any particular cases you can refer to that give us a sense of how this is being interpreted? Because you really get the feeling with mental health that almost everyone is feeling their way a little bit.
And everybody's concerned, what do I do if? And if it does come up, then there's this huge risk. How do I manage it? Yeah. So definitely a big concern. And we've spoken a little bit about unfair dismissals. The big concern for employers is the other type of claim which starts life in the Fair Work Commission, and that's general protections or adverse actions claims, where the employee is essentially saying, you dismissed me or you treated me adversely, you demoted me, whatever it might be, because of my mental illness. So the employer in that situation needs to disprove that. So they need to demonstrate that they took that adverse action for another reason. So the cases that we have dealt with and that we are seeing deal very much and turn on that decision-making process. That is a huge impost on that person making the decision. They need to be able to persuade a court or a tribunal that the reason they made that decision was because of a performance issue, was because of a conduct issue. And we then end up in this territory where we need to understand what is the mental health condition and what are its manifestations, what was the conduct, and how do we separate the two or the three. So it's a challenging area. And that's where it's really important to make those inquiries and understand what was the reason for the conduct. Because there's that reverse onus of proof, it sometimes can result in employers being reluctant to ask questions because they think, if I don't know, I can't take it into account.
It can't be shown that it influenced my decision-making one way or the other.
Exactly.
Yeah. And is the legal standard that the employer has the reverse onus of proof to demonstrate that there was another predominant reason, or is the discriminatory reason not even allowed to be anywhere in the mix, even to 1%?
It shouldn't be in the mix.
At all.
Yeah.
So it's not about predominance of reasons, it's about...
It shouldn't have a substantive or operative part of that reason.
Yeah.
And the second that it is coming into play, the mental illness, not necessarily the fact that the person cannot perform their role or their duties, and this is where this separation is really important. As soon as that does become a factor in somebody's mind, it can be very difficult to persuade a court or a tribunal that there was another reason.
And my understanding is that the legal definition of a mental disability is a fairly broad one as well. It can be current, it can be past, anticipated future, real or believed to be real.
Absolutely. So there's no need for a diagnosis.
Yes, yeah, it's very broad.
Absolutely, yeah. So with the scenario where the employee starts to mention what you might think are symptoms of a mental illness, regardless that it's not been diagnosed, you still need to treat that in the same way.
That's often the advice we give in the training room too, that for a manager to get all caught up on the questions around, well, is it really a diagnosis? Isn't it? Could it be? That is just a road to nowhere worth going. From the manager's point of view, better to err on the side of presuming that there could be something there that merits further questioning.
Yeah. Let the experts tell you.
Yeah. What trends are you seeing in Fair Work in terms of the way these things are being regarded? Is there any insights you can share about any recent matters you've worked on or your colleagues have worked on that shed some light on the current way these cases are being interpreted?
In terms of the current way they're being interpreted, like I said, the main area that they're coming up is in the general protections jurisdiction. And it is very much the focus of the decision maker and being able to prove that ultimately the reason was not that mental disability. That isn't the reason for the dismissal. The way they often end up in that jurisdiction is typically because there's an employee who cannot perform the inherent requirements of their role
and they have been absent for some time. So it's important in those scenarios to really make sure that there is no capacity at that time or in the future. And that can be a frustrating journey for employers, because the doctors are sometimes reluctant to provide those answers, to provide that information. But ultimately, if an employer is going to make the decision that this individual cannot perform the inherent requirements of their role, they really have to obtain that information. And it's not simply, can they do the role now, can they not? It's more broad. What parts can they do? What parts can't they do?
Yeah.
Are there any limitations? Are there adjustments we can make? And, that's a whole another area that we need to consider.
And the nature of the work relative to the restriction is obviously relevant to the size of the business.
Yeah, absolutely.
To their capacity to absorb those changes. Do you have a favoured way of explaining to employers the idea of inherent requirements for position? There's so many different ways. I'm curious as to what your preferred way of explaining to a member is that idea.
I often think about, what are the fundamental things this person must do? If you take away those things, the role doesn't exist. What are the absolutely ultimate must-dos of this role?
The words that often come up are ultimate, fundamental, key, core. Those adjectives seem to be thrown around a lot.
And employers will still scratch their head when you say, can you put a list together? They think, and they find it a really challenging task.
Disciplinary processes that are likely to cause distress. Your thoughts around some best practice when the process still must happen in some way, shape or form, but how it happens when it's a high-risk situation?
I think planning is really important. So you've got to plan what are the key messages that must be communicated. So in terms of a performance management or disciplinary process, it's really vital the person understands what's at stake. If they don't, you're wasting your time. So they must understand that. That message needs to be quite clear. That said, the person at the other side of the desk is a human being. Accept it's an uncomfortable situation and talk to them in a courteous, professional manner. Let them open up. You will get the most out of the meeting that way, as opposed to seeing somebody become distressed and you constantly press them to get information. That's only going to make things escalate.
It's certainly one of the themes that comes through workers' compensation cases around the procedural reasonableness of a management action. There's a few cases I can think of where the employer really should have adjourned.
Yeah.
That is pressed on, and that has brought that management action into the territory of unreasonableness.
Yeah. It's that, don't be afraid to stop. You can pause, take 5 minutes. 5 minutes might not be enough. You might need to come back the next day. Who knows? Don't rush these things.
And you've dealt with cases, I'm sure, where the disciplinary process may have to be conducted off-site or in the presence of someone's psychologist, or I've had a few of those in my time.
Absolutely. Sometimes people, for whatever reason, do not want to step back in the workplace. And if you know that is a stressor, is there somewhere else that you can reasonably convene this meeting? Often employees can be reluctant to engage in a face-to-face meeting, but I think that always has to be the preferred approach. It's always better to have those face-to-face meetings than deal with things in correspondence.
And there can always be representatives and support people involved. And
absolutely.
Things like that,
yeah, support people can be involved. And, strictly speaking, a support person is there to provide that emotional, moral support, not to advocate or speak. But depending on your level of comfort, you can encourage them to feel more part of the meeting and that way get the employee to actually participate a bit more actively. Often, if you set the scene in that way, the employee may feel a bit more relaxed and able to engage, as opposed to as soon as they walk through the door identifying this person's a support person, you can't say anything today. You're setting yourself up to fail there.
Do you have any tips for just dealing with skepticism when you encounter it? The response often is, what if the employee is just using it as an excuse or turning it on? I mean, I know what I normally say in those circumstances. I'm curious what you do.
They absolutely may be right, but what if they're wrong?
Yeah, interesting.
If you know you are that way inclined and you're more than likely to have that response, are you the right person to be holding that meeting, having that discussion? Is there something you can do to help yourself and help the business conduct a fair, reasonable process and make a just decision.
The point I often make to our participants is that if you are feeling very strongly about the individual, if you have strong views about their work ethic and their life decisions and things like that, then you automatically know you have a high-risk situation, because chances are other decision makers in the business feel the same way, and the groupthink will kick in and you're at high risk of making a poor decision. When I think of those three cases that we studied, there's a few common threads. I'd be interested to get your perspective on this, but there's a few common threads that run through those three cases. One is that the decision makers clearly despise the employee. Even not knowing it, not having seen the interactions, it's just so clear. They have a very negative view of the individual. The other thing that is interesting to me is a very distorted perspective of risk as well, like a lack of perspective on how the situation may appear to a neutral, independent third party, a judge, a commissioner, a media outlet or whatever it is. You're dealing often with large organisations with no shortage of lawyers and in-house HR people, but it's incredible how with those cases, when we ask our participants to guess the outcomes, they always get them pretty quickly as well, because there's no emotional investment in the case. Is that your experience as well?
It is. That said, having spent some time working in-house, I have seen how you can avoid that very situation and how it is really important. If you are a large organisation and you have the luxury of having employee relations experts, work health and safety experts, your managers, the decision makers, how they can all work together and make sure the correct decision is made. So if I think about my personal experience, if I had a manager who had the blinkers on, this person is gone, cannot tolerate them, it doesn't matter what they say, they're not going to persuade me. It happens. My job was to really test them and firstly make sure they understand if this person goes and they subsequently make a claim, you have to own that decision. You're going to be the one that has to stand up and explain why. You have to give your reasons, not me. That's your role. It was my job to obviously make that clear, but also advise them on what are the risks? What does the law say? Where are the risk points in this situation? Are there any internal policies or procedures or things like that we need to be made aware of? Make sure they have taken into account everything relevant that the employee has said and think more broadly, what else do we need to take into account? How long has the employee worked here? And that can be something that goes in the employee's favour but can also go against them. If they're engaged in a particular behaviour and somebody's new, they may not know that that's not acceptable. Compare that to someone that's been at a business 20 years. Well, they ought to know. So, it can go in lots of different ways. But that in-house experience and having that division was a really good way of seeing, and it work in practice, that the role of a good employee relations advisor is really to test and push and make sure that decision maker makes the right decision. That said, when you don't agree, that's fine. I dealt with a lot of cases where we would have to escalate matters to the manager's manager, and then if, again, we couldn't agree them, and it would go up the chain until you're dealing with CEOs and finance directors and the like. And it was about, we as a business need to own this decision and be comfortable with the decision. And if there isn't that agreement, and it's fine to disagree, but we need to continue to test that. I know there were a couple of cases where, and it's not ideal, but a decision took 2 weeks.
There was a phrase you used there that just for me is a red flag when you were speaking as the manager, that phrase of there's nothing you could do or say to change my mind. You've inflicted such reputational damage. The relationship is disintegrated. The person surely has, by definition, failed the mitigating circumstances test.
Absolutely.
If they bring that mentality to the table. As you say in the earlier part, it's about that open mind.
Absolutely.
And being willing to consider what's been put on the table, no matter what it is, no matter how sceptical the
and
business
as
might feel
an
about it.
employer, you need to have confidence that your people managers, the ones that you entrust to make that decision, don't have that mindset.